Hello everyone, happy Monday. Today is Monday, July 27th. I'm Dr. Rendi Murphree, an epidemiologist and the Director of Disease Surveillance here at the Mobile County Health Department, here to give you our Monday update on the impact of the COVID-19 pandemic on Mobile County, our residents, our economy, our culture, our social fabric. It's just crept in on all fronts. So worldwide, there have been more than 16 million cases of COVID-19 disease with just over 650,000 deaths. In the U.S., we're at almost 4.3 million cases and 147,000 deaths. In Alabama this morning, there were just over 79,000 cases of COVID-19 with 1,446 deaths. This morning in our daily report, we reported on 7,440 cases of COVID-19 among Mobile residents. That was an increase of 169 cases on yesterday. We have 183 who have died. We still are not able to show the number hospitalized on the daily report due to some technological issues that we're working through, but we hope to get that started again soon. And I do have some data on hospitalizations to share with you from our weekly expanded report. So by week of report, it looks like we added around 1,200 cases last week. Sorry about this, I got a necklace going the wrong way. Actually, the number of cases has continued to rise. This is, again, accelerated rate, 1,202 cases added last week. That was a slight increase over the previous week, but we are seeing, again, on an average day, we're adding about 175 cases a day. And this is by far greater than anything we have experienced to date. Again, if you look at the 7-day and 14-day moving averages, you can see sort of balance the noise out from Monday through Friday reporting and see what is happening on average by day. So our expanded report, this is the one that I run on Sundays after the data closes out on Saturday evening. So in this report, there were around 7,200 cases and 181 deaths. And again, on Thursday and Friday and Saturday, or Friday, Saturday, and Sunday, we added, in the mid 160s number of cases each day. We're still seeing most of the cases occurring in the younger age groups, most of them female, around 40% African American, around 22 to 25% white, and some other races are reported. We have on figure 3 on the expanded report, we continue to show you sort of the breakdown of the number of cases added by week by age group. We saw a slight change in that we're seeing a few more cases being added in the 50 to 64 age group. That corresponds with also seeing a rise in the number of COVID patients who were hospitalized. And again, on figure 4, if we look at the 14 and 7-day rolling average, we're averaging around 150 or 160 cases each day. I put this figure in here, this figure 5 in here today. This looks at the number of cases reported by month. So this was March, when our first case was just reported on March 13th. So March, April, May, June, and July. So July is not even over yet, and we have more than double the number of cases compared to what was reported in June. So more than doubling of the number of COVID cases reported in the month of July compared to June. The data on deaths is back in our expanded report, so you can see that the number of deaths are starting to go up again. This is something that we've been talking about, that the number of deaths generally lag behind. It's a lag indicator. So among those who have died, and this is a sample of 181 deaths, our first 181, the overwhelming majority of them are over 50. So only around 2% of people who die are less than the age of 50. But we did add one new death in the 25 to 49 category, bringing it to 3. and that was a 38-year-old with severe underlying medical conditions, and that's a tough loss to that person's family and friends. About 78% of people are over 65, but again, 98% of people who die are over the age of 50. And most of them, nearly 90%, have underlying medical conditions. About half of the people who died were associated with long-term care facilities, and around 40% of the general population required mechanical ventilation, and we'll talk a little bit more about that when we talk about hospitalizations. So page 6, this is the new data that's been added on hospitalizations. This comes from the Alabama Incident Management System, or AIMS. These data are quite a bit different than the data that we normally report on, because they include anyone who's been hospitalized in a Mobile County hospital. So when I talk about cases and deaths, I'm generally talking about only Mobile County residents. But now that we have switched to using AIMS data because of some difficulty with our traditional system, you can see that the number of hospitalizations is just over 1,000, so 1,072. That's a cumulative number since March. 1,072 people hospitalized with COVID-19 in a Mobile County hospital. And the moving average for those is around 160 or 175 people are admitted daily to hospitals in Mobile County for COVID-19. If we look at the age, sex, and race breakdown, the age and sex looks about the same. For people who are hospitalized, a higher proportion of them are African American, around 57%, and 33% are white. The average duration of stay for hospitalized COVID patients is 10 days. Of all hospitalized patients, about 17% lose their battle with COVID and die while in the hospital. And of the ones that who died that we have information on, so about again, hospitalized and died, those severe indicators, 77% of them required intensive care and 62 required mechanical ventilation. We know that those are indicators for severe outcomes and very highly predictive of death among hospitalized patients. So we are still providing information on the percent positive number of laboratory results. So this is in figure 8. So it had been running around 22-21%, but the preliminary data for last week shows that it has gone down again slightly to 15% of all laboratory tests have tested positive for COVID. This is a small glimmer of hope in that, 4 weeks straight reduction in the amount, the percent positive of all laboratory tests might be an early indicator that, our efforts to physically distance ourselves and wear a mask and other things, that it may be having an effect. We'll continue to keep an eye on that. But again, it's been a few days since we had, case counts in the 200s. We're seeing this trend in the lowering in the number of, or the percent positive test results among all test results. So that may be some encouraging news that our mask order may be having an effect, but we will keep an eye on that. So please keep up the hard work of trying to comply with those public health messages. Again, on the map, we're just showing the cases from community transmission just the last 2 weeks. So take a look there and see where we have, a lot of community transmission going on right now. Again, 36608, 36695, 36605, 36582, 36618. Those are the hot spots for us right now. All right, we get asked about the number of complaints that we're receiving, and we have, I think, we have really 4 teams that are fielding calls, complaints, consultations, passing along recommendations. We have the food establishments, and last week they reported, I think, having received a total of about just under 20 complaints. So it definitely has gone down since we first announced that you can, send a complaint anytime to IS Complaints if you have a complaint about a permitted establishment. And then we have a team that is answering calls from the community, complaints against business owners that aren't permitted by the health department, where we just call and try to inform and educate those businesses about the mandatory mask order and about physical distancing and other public health measures, disinfection guidelines, those sorts of things. So I think last week they had received 35 calls, and that did not include some that came in over the weekend. So we'll continue to provide that information for you. And let's see, I think I'm to the Q&A session of the program. So bear with me here, as we've had quite a number of inquiries. We get lots of requests for information about trying to look at data in a different way, or people really wanting to see age broken down a different way, or wanting to see race split out differently. And what we have done very early on, really before anyone in the state was doing it, we began aligning our statistics that we use with the way the Centers for Disease Control reports data on COVID. So we will continue to do that. We do, however, every once in a while make some adjustments, and don't put them permanently in our report, but provide them verbally. We've gotten several requests because of school starting back about trying to break out our age group so that we can see more sort of, pre-K, K through 12, young adults that may be going back to school at colleges and universities, and then the older age group. So we will definitely take that to our executive team, our decision team, to see if that's something that everyone agrees would bring value to our report. See, someone asking about guidance on schools and not really sort of knowing who to listen to or what to do. And yeah, there is a lot of information out there on all kinds of recommendations, and it's a challenge to muddle through and to try to swim through the sea of guidelines. But specifically for schools, CDC updated their guidance for schools, probably a dozen documents, on July 24th, so over the last weekend. So there are things in there specific for parents who are trying to decide, if they should send their child back to physical school or do a blended education or keep them at home. There are decisions for superintendents and administrators, checklists. But I was on a call today at 1 o'clock with CDC, and several states were asking, hey, all of your guidance says schools should not be reopening when there is, when transmission is high in the community. But you haven't told us what that means. What does it mean that an area, jurisdiction has high risk of transmission, and perhaps they should consider delaying the start of school or having remote instruction? And CDC doesn't have an answer for that. It's certainly not a single factor, it's multifactorial. And what they have done instead is to try to provide as much information and guidance as superintendents can to make the best decisions for their students and staff based on what's happening locally in their community, about what their students look like, what they can do in their school to try to create barriers to transmission, those sorts of things. So if you have not been to the CDC site lately, go there, look at the schools and child care programs and there's again updated guidance on July 24th for school and program administrators, and also for students, for testing, for cloth face coverings, decisions for parents, checklists, all kinds of information there. So please go and take a look. Yeah, someone had written to ask, looking for some hard numbers on, trying to make this decision about reopening a school or not. And unfortunately, that's just not a place that we're in right now. Let's see, someone talking about going back to work, a daughter who was positive but asymptomatic, and can you be released without quarantine? Yes, we are recommending, we're not recommending the test-based strategy for discontinuation of isolation and quarantine at this time, based on a lot of really good information. And let me share with you the guidance out of the Alabama Department of Public Health on the CDC isolation guidelines change. Most adults have mild to moderate illness and can now leave isolation after completing 10 days in home isolation, and persons do not need to be retested before going to work. That's according to CDC guidelines. So no longer should employers require a negative test for an employee to return to work. Nor should you require that test for return to school or, entry into a business or anything like that. We are not recommending that anymore, based on CDC guidance that the overwhelming majority of people who are infected are no longer infectious to others several days before 10. So we're using 10 days just as sort of the hard stop, just to make sure, 99.9% sure that you're no longer infectious to others. So again, based on the latest scientific data that show that most people are no longer infectious 10 days after symptoms begin, or of the test positive if you don't have symptoms. So let's see, equivalent data for infants and children is not currently available. So in the absence of specific data, we apply the same guidelines to the pediatric age groups, the children and infants. So again, if you have a COVID positive test, whether you're symptomatic or not, it's isolation for 10 days. The last day has to be symptom-free, and you should return to work or discontinue isolation or quarantine, return to school, return to daycare, return to group home, return to work with no testing recommended after 10 days. All right, so let me move on from that one. The other thing that we get asked a lot about is, why is it 10 days if you're sick and 14 days if you're exposed? So as I just mentioned, CDC has learned a lot. They've collected a lot of evidence around how long someone is infectious after their first symptom onset or after their test is positive. And they are convinced that after 10 days, you're no longer infectious to others. The science around someone who is exposed and the length of time that it could take for them to realize they're, have enough virus in their system to begin sharing or showing symptoms is 2 to 14 days. So unfortunately, the biology, it takes longer once you're infected for you to develop symptom. That window is 2 to 14 days. The average is 5, but we go out to 14 days again to make, certain that you're not going to become ill with COVID on the 15th day and begin spreading it. So that's why 10 days is if you are sick and we know you are no longer going to be shedding virus after 10 days. And for people who are exposed and may have been infected, a new infection, the timeline for developing symptoms is 2 to 14 days. So that is the reason for you have to stay home longer if you're exposed but not sick. Sorry about that. Some people have to stay home 14 days and then 10. So if you're at home and you're quarantining for 14 days and someone, else in your family then develops symptoms of COVID, then you have to start over. All right. Let's see. Here are a couple questions. Update on what we're hearing about hospital beds. Are there still beds available? There are beds available, but we are hearing that, just like everyone is, that hospitals are seeing a lot of COVID admissions these days. Again, on average, 260, 270, 275 a day. So it is definitely a challenge out there for hospitals right now. Part of the bed question has to do with, do they have enough staff available to staff all the beds that they do have? Because of course, healthcare workers are at high risk of catching COVID, and Anyone who is exposed or COVID positive has to go home for 10 or 14 days. That makes it often a challenge for the nursing homes or the hospitals to keep their beds staffed and open. So there are lots of things that come into play there. I'm hearing from the Alabama Department of Public Health that there are ventilators available and that they're having good success moving them around to where they're needed. That the same thing is happening with remdesivir, the drug that's shown great promise in reducing the number of deaths in people that are hospitalized and in intensive care units. So hospital systems are working together to try to move resources around where they're most needed. Why are the number of cases in Mobile increasing 3 weeks after the city implemented a mask ordinance? Are masks really working? Well, I don't really think people took the city of Mobile mask ordinance very serious when it was first implemented, because we didn't see a lot of compliance with that mask order. Now that there has been a statewide mask order and our cases have been going up, I think people are realizing that this is very serious and that they should comply with the direction or with the request or the health orders of the health department, the Mobile County Health Department, State Health Department, and the Centers for Disease Control. So I don't think that the original City of Mobile mask order or the health officer mask order for unincorporated locations was heeded. I don't think people took it very seriously. I don't think that they complied with it. But now that we have seen the adverse effects of and seeing this enormous rise in the number of cases, I think people are beginning to take it more seriously. And as we see more cases, nationwide, other big box chains are starting to require the wearing of masks. And so as we have the big box, the big grocery chains begin to mandate mask ordering, we're starting to see a lot better compliance with the mask order. So it is likely that we will only just now begin to see the impact of a mask ordinance that has had good compliance. Let's see. If you've been exposed, should you quarantine for 14 days? Yes. If you've been exposed, you quarantine. If you develop symptoms during the 14 days, then your 10-day clock starts. So if you're quarantined for 14 days and you develop a symptom, then you have to stay at home from another 10 days and discontinue quarantine when you're symptom-free for 10 days with at least the last 24 being symptom-free, and you should not get tested. And the question here, whoever wrote this comment wrote exactly what I just read to you. So someone has been listening because they got it exactly right. And then the question was, how are you counting those cases that don't get tests? Anyone who is a close contact that develops symptoms, they can be counted as a COVID, as a COVID case without requiring a laboratory result. We report that daily in our probable count, so that is considered a probable case. That's something that we've been doing for a couple of months. So again, if you're a close contact and you develop symptoms during your quarantine period, then you are presumed as being COVID-19 positive based on your exposure and your symptoms, and we count you as a probable case. Okay, someone else asking about the 10 and 14 day difference. Yeah, so remember a couple things about testing. If you test positive, you should not get tested again for at least 3 months. I want to make sure everybody hears that. If you got tested and you're at home quarantining, we're not going to test you to try to get you back to work based on a negative test. That's not what we're doing. You stay home your length of time, and when your time passes, then you can go back to work. No retesting of COVID positive for at least 3 months. All right, and last thing today, I'll just read a... Oh, okay, go ahead.
Update on the lag between test and results.
Yeah, the lag between test and results. So someone is looking at that graph that I put in today, but I didn't mention. So we put a, this is not going to be easy to explain. So I think someone's asking about figure 9, this, the lag between when a specimen is collected and when the laboratory test results gets to public health. we have been hearing all over town about delays in laboratory results reporting. We know that the state lab is caught up. I heard that on a telephone call this morning, that they are caught up. I believe that most of our local labs are still within maybe 72 hours. Hopefully fewer of them are taking 3, 5, 7 to 10 days. But this chart on figure 9 shows very early on when the average number of days between specimen collection and report to public health was quite long. The average was like 17, 19, and 23, and the range could be from, turn it back in one day to take several weeks. And I was trying to see if we could see if that's been happening in the past 3 or 4 weeks, looking at the data, not just the rumors. And it's really too early for us to tell because, if a lab result is going to be delayed by 10 days, I won't know about it until 10 days from now. So when I'm calculating this average based on the last week, it's really not a very good measure of what's happening. And I tried to poke around and look some other ways and didn't have much luck to sort of see if I could, see if it was a specific lab or not. And so I'll have to keep looking at that. Okay.
Do you think our area is showing a high rate of transmission in terms of school reopening?
I don't think there are enough. I'm not sure. Maybe let me answer that question two ways. Do I think school openings are contributing to high rates of transmission?
Think our area is showing a high rate of transmission in terms of school reopening?
We have a high rate of transmission, period. The highest that we've had since things began in March. Whether or not that has crossed some threshold that schools should consider changing their minds about reopening, I don't think we're there. Again, that's not a decision that the health department makes. That's a decision that the administrators make in the context of all of the other reasons that kids, need to go to school. A lot of that information that CDC updated over the weekend has a lot of good explanations about why it's good to get kids back in schools if it can be done safely. So I know most of you out there are not happy that I won't sort of take a stand on whether or not I think schools should reopen because it's just too complex. It's more complex than one person or a couple people at the health department can determine. So we are continuing to consult with schools, daycares, universities, colleges to try to help them make the best decision that they can. All right. So here I'll read a news release that should hit in any minute now. So the health department will be making changes to our Facebook Live schedule. So the Mobile County Health Department began a daily Facebook Live update back in April in response to the COVID-19 pandemic. The concept was intended to provide current information on the status of coronavirus while answering questions from the media and public. The response has been incredible. It really has. According to Facebook metrics, the updates normally reach thousands of viewers each day. One episode, it was the day after Memorial Day, I think, surpassed 61,000 views for that one episode alone. But the recent increase of COVID-19 cases in Mobile County has placed a greater strain on staff in day-to-day response in our community. And because of this, the Facebook Live schedule will change starting this week. So we've been doing these weekdays at 2:30. The new schedule will have coronavirus updates on Mondays and Fridays at 2:30. And on Wednesdays, we will have our return to sort of our special Wellness Wednesday episode and to provide information on many medical and mental health topics, including COVID-19. We will continue to provide the daily report, the patient characteristics data, on Monday through Friday. And the weekly review will also continue to appear each Monday. And again, look for these on our website. They're archived at mchd.org and on our Facebook page at I Love MCHD. So again, starting today, we will have our next Facebook Live COVID update on Friday at 10:30, and Wednesday we'll have the Wellness Wednesday update. And I don't know what the topic is, so come back and tune in to see. So thanks, and we'll chat with you again on Wednesday.